I have a lot of patients who come in and they're anxious and nervous and afraid. In fact, I get a lot of patients who come in that haven't been to the dentist simply because of the fact that they're afraid. And my take on that is there's no reason for that. Am I correct?
Yeah, you know, there's a lot of patients that we see that have extreme needle phobia, and I found that to be largely what I encounter, and you probably have encountered the same thing as well.
Yeah.
So you know, and a lot of times, you know, especially for implant surgery, they've delayed taking care of themselves.
Right.
So then we're left with, you know, trying to pick up the pieces after that.
Exactly. So you see patients who are just afraid of just the needle itself, correct?
There are patients that are afraid of the needle. So my approach, you know, from an anesthesia point of view, the biggest thing is the IV placement.
Absolutely.
So here, you know, what I've instituted is that I place all my own IVs. I don't have anyone do them for me. And we use bicarbonated local anesthetic with a very tiny needle.
Yeah.
And that way, they barely even feel the IV before it even goes in. And I've incorporated that into my practice for years, and I find that that's very successful.
Right.